Hello everyone. My name is Bakhita Al-Marri from Arayan. Our vision is, can you just make it bigger? Because I don't have control on it.
It should be bigger. Is it not when I put it into presentation
Like
mode?
a slide, slide show.
Okay, let's do it like this, a bit larger. Is that better?
Yes.
Okay.
So, as you know, Arayan is a rich history as a learning city with a modern universities, college and schools and historical moments such as Al-Wajba Fort. And it has many awards, FIFA Stadium and Qatar National Library. So the vision of the Ministry of Municipality is improving the quality of life to achieve Qatar National Vision 2030. And our mission is excellence in providing services and optimal planning for city while maintaining the sustainability of natural resource and achieving food security for us and for future generation. So based on the practical guide of learning cities, we transformed the sustainability development goals into a local measurement in Arayan city. So the first sustainable policy implementation and feasibility in Arayan was opening an open air, first air conditioner park, which was in last year, Nasim. And then after that, next please. After we get recognized from World Health Organization as a health city, we did cooperate and more focusing on implementing policies in Arayan by and also ensure that equity empowerment and intersectoral collaborations. Next. So we did aspect on that by social media campaigns, promoting recycle signage in the public places, educational activities in school and universities, and exposing the youth, especially we focus on the youth, to a sustainability. Next. So recently we opened the second air condition park, which is recognized as has a recognized to be longest AC outdoor bath, and it was in Nasim Park. The first one was Al Gharafa Park, and this is Nasim Park, the recent one. Next, please. So we did also mobilizing and utilizing monetary and non-monetary resource to build a learning city. So by that, we did a utilization of a human resource, especially the municipality employees, to conduct the training and educational courses for target community group, such as student workers in the food premises or in the cleaning premises. And we also using municipal facilities and public park in the neighborhoods of Arayan to ensure the sustainability of these places by creating centers of multiple activities. Next, please. We did also using advertising platforms of raising health awarenesses to promote positive value among youth, adults in schools, parks, and public facilities. Next, please. Next, please. There was also cooperative with the community by planting trees. It was 2022, going to the theme of FIFA, and this area will be using for mountain bike around 35,000 square meters. Next, please. We did also a school and initiatives such as social. We applied this civil society mobilization from the school and university students, where they are involved in the initiatives to plant 1 million trees. And the university students were volunteers on a cleanup beach campaigns also. Many. Next, please. Araya municipality also did participate in in a campaign which called "We Are All Responsible," which has many sectors of stakeholders as a civil society to increase the awarenesses of responsibility and sustainability toward the community and toward the state. Next, please. We did also mobilizing the citizen. We have an environmental activists who was cooperating with us to do a planting and increasing awarenesses among the community of planting and desertification. Also, we have an environmental activities which raise awarenesses about the sustainability, and she always focusing on the youth. Next, please. We did increasing awareness of health by cooperative with Weill Cornell Medicine in Qatar in a campaign called Your Health First in flagship public with them. And it was launched the fitness box, an innovative new concept in health and cooperation with the Ministry of Municipality Public Parks Department, with a launch event in Al Rayyan Park. And this fitness box is, this is the start. And we have after that 2 more. And we want to achieve our target to open all of this awarenesses campaign in most of our parks, hopefully. Next. This is Al Gharrafa Park, where we had the bike line, and we also have underneath the area of kids area, but it's especially for kids with special needs. Next, please. We do also focusing on the vulnerable people, such as the workers. So they were involved in many campaigns. Next, please. This is the campaigns that we did. Next, please. Okay, we did sign a memo of understanding with the partnership of sustainability and recycling with Elite Recycling, also with a Shafallah Center, which is for kids with special needs, and for the Ihsan, which is for improvement and empowerment and care of the elderly. Next, please. Okay. This law has launched in 2020, and it's implemented now, right now, because it's 15 November. So this law is prohibited the using of plastic bags. So, and after that, we did campaign. Next, please. We did a campaigns to increase the awarenesses to the food premises and supermarkets to stop using the bags. This is before the implementation of law. So after that, now it's stopped. And next, please. Also, we did awarenesses to the workshop to the safe and wholesome food to increase the awarenesses of food premises and solve the common violations by food handlers and cooperate with them to serve the consumers. Next, please. Okay. Future actions is conducting a need assessment in consultation with the community leaders and key stakeholders to determine what education programs are of interest and how to roll them out most effectively. Next, please. Thank you so much.
Thank you very much. Thank you, Ms. Al-Mari.
You're welcome.
Very interesting insight into everything that's happening in Al Rayyan in Qatar. And I think that your presentation really touched on a number of different domains covered by Learning for Health. There were environmental issues, exercise, nutrition, lots of diverse aspects that all feed into lifelong learning for health. So thank you for sharing with us, and we'll probably have some questions for you later. So with that, then I will move to our next presenter. So joining us from the city of Nairobi, I believe we have our presenter, although I don't see her right now.
I'm here.
Ah, you're here, sorry. Sorry. Okay, so Miss Esther Kimani from
Yes.
Nairobi, the floor is yours. And would you like me to share your slides or would you prefer to do so?
You can just share.
Okay, no problem. Give me a second. Okay.
Yeah.
Over to you, thank you.
Okay, you could go to the first slide. So as you do so, Nairobi is the capital city of Kenya. Kenya is a country that is in East Africa. And as a county government, we are in charge of early childhood development and education, as well as child care facilities and vocational education and training. So we have very many programs that are towards lifelong learning. However, I'll only touch about those that touch on health policies that are implemented by the Department of Education, for which I belong. So we have adopted a multi-sectoral approach, working with different departments, for example, health sector, water and sanitation sector, among others. With regard to our collaboration with the health sector, they help us in growth monitoring and promotion services, which include micronutrient supplementation for children in all the early childhood and development centers. ECDs is early childhood development centers. Nutrition education, management of moderate and severe malnutrition, as well as overweight and obesity children, deworming of school children, offering dental services to children, and also care programs for children with developmental difficulties or disabilities. You can see some photographs showing our health practitioners in our schools. Deworming, that is one of our schools called Lady Northy Day Nursery. They are offering deworming services. The other one is a supplementation session. You could move to the next slide. We also are in the process of disseminating the school health policy to all our sub-counties. And this policy outlines the various strategies with regard to lifelong learning for health and also holistic development of a child. So we are also in the process of training of both education and health staff on teachers' guides to support learners with chronic illnesses. We have been doing sensitization of teachers and pupils on COVID-19 and other infections prevention measures in schools, distribution of materials for the same, and we also reintegrating pregnant teens back to school and offering maternal, infant, and young child nutrition support, as well as strengthening existing school health clubs. Next. We have a standardized feeding program whereby we offer children 10 o'clock porridge, which is fortified, hot lunch, and milk. As you can see in that photo, those are learners of an ECD center called Plainsview, enjoying a meal. We also provide water and sanitation facilities. This is in collaboration with our water and sanitation department. We make sure that there is adequate play facilities because we believe that the formative early childhood development years, learners learn through play, and also play facilitate the proper growth of our children. As you can see in the photos that are attached there. We could go to the next, trying to rush in the interest of time. We continue to construct and expand vocational training and education centers, trade areas, whereby we ensure that those courses that were not previously offered are now being offered on demand, and also tailoring them to the industry demand. We are rehabilitating our national libraries and also county libraries. As you can see in the photo that is on the extreme left at the corner, that is one of our libraries called Eastlands Library at night, because we are ensuring that our economy is a 24-hour economy. Then we have an act, which is the Nairobi City County Child Care Facilities Act in place, and we are in the process of developing regulations to operationalize it, which is at the very last final stages of enactment, so that we can ensure that the childcare space is regulated. We usually rescue, rehabilitate, reintegrate, and resocialize children who are connected to the streets and children who are in other vulnerable situations. As you can see in the photo that is on the extreme right at the corner, that is a girl who has just been reunified with the family after being rescued from the streets. We provide shelter and safe spaces, as well as integration of child protection matters with all public health institutions. And we also offer psychosocial support to children and link them to all public pre-primary schools. Move to the next slide, please. With regard to sustainability measures, we have a capitation grant that we call Free Early Childhood Development and Education Grant, whereby every child is allocated 3,200 Kenya shillings annually, and those with special needs are allocated 100 shillings extra. This is whereby this money goes to various boat heads where feeding, school meals, also curriculum support materials are also bought from that support grant, capitation grant. Then we increase transition, access, and retention to secondary schools and tertiary institutions by distributing ward and executive bursaries. For example, in January this year, we distributed bursaries worth the executive ward bursaries worth 382.5 million Kenya shillings, and executive bursaries worth 207.5 million Kenya shillings to about 81,500,000 beneficiaries across the country, because we identify them, those that are from Nairobi City, but then they are enrolled in all the schools across the country, and we support them to ensure that they continue to study. Then we recruit qualified teachers on permanent and pensionable terms. Our current ratio of teacher pupil in the early childhood development centers stands at 1:26, I think that's a fairly good, because the national policy requirement is 1:25. We are almost hitting the target. We have in existence a school health unit in the health sector, which supports school health programs, like I had mentioned in the first slide. And then we have functional preschool boards of management, and also we have vocational training centers, boards of governors. We continue to capacity build our teachers on responsive caregiving, positive discipline, inclusive education, and also the curriculum that is in place in Kenya. We ensure that our parents are engaged in all the matters pertaining to the learning of their children, and we have empowerment programs for them. We also train our parents on positive parenting, and we are also currently we have a program called male involvement a training program, because we had noted the laxity within the male parents with regard to the learning of their children. Those are some of the photos that are showing some of these things that we are doing. That is an induction session for our teachers, and the other one is during a distribution of bursaries for our learners. The next slide, please. We have a youth affairs section in our sector, and it is vested with the promotion of youth activities, that is socioeconomic activities. They also carry out campaigns and awareness to young adults or to youth, and also they promote capacity building to youth groups on various topics, among them drugs and substance abuse, mental wellness. And also we have a community development section that promotes socioeconomic empowerment programs to members of the community who are joined in groups. And as you can see, the photos that are below that bullet, those are some of the exhibitions of some of the community groups. After they have gone through training, those groups are groups of individuals living with HIV and AIDS. And some time back, when there was a lot of stigma with regard to HIV and AIDS, some of these people were suffering from low esteem. But then through our community development section, we are able to bring these groups together. We empower them, we train them. We also provide platforms for which they can showcase their goods, like you can see there. And we ensure that at least they are able to get a market for them, and that goes a long way into increasing their self-esteem, and also ensuring that they see like they have value in their life. We also carry out community dialogues on youth groups, as you can see in those campaign posters that are attached there. Next, please. How lifelong learning for health policies and programs are made visible is through signposts in all the ECDs that are talking about free ECDs, such that now parents who are not even able to take their children to school because of poverty, they are able to bring them to the county-run early childhood development centers. We also have posters on healthy practices, like critical times for hand washing and hand washing procedures in all county-run institutions. And we participate in national co-curricular activities like music and drama festivals. All our learners in the ECDs and vocational training centers participate in the same. Next, please. We monitor systems. We monitor the lifelong learning for health policies and programs through carrying out of quality assurance and standards assessments in all our institutions, whereby we have standardized tools that look at various areas of interest, including water, sanitation, the general safety of the environment. We look at the meals and how they are offered, whether the providers are sticking to the standardized menu and what have you. Then we are in the process, like I had said, of regulating the childcare space. And also we link health facilities to schools for close monitoring, and also to help us address any emergencies that come up in schools. Next, please. Local communities are involved in lifelong learning in the implementation of our initiatives. For example, they are very key in providing resources like land and spaces for establishment of learning institutions, because every residential area has to surrender a piece of space for construction of schools, also for play fields. The local community also supplement the curriculum support materials. They also help in being experts to aid in learning processes through mentorship programs. The curriculum that I talked about, called competency-based curriculum, that is in place in Kenya, we have expertise from different fields coming to schools to talk to our students on their areas of expertise, so that at least our learners can have people to model from. Also, through parental engagement and empowerment programs, communities ensure continuous learning outside the learning institutions, so that learning does not just stop in our schools, but we ensure that even when learners are at home, when they are in churches or mosques, they are also continuing with whatever good practices they are learning in schools. Then we have community health volunteers who provide health interventions, awareness and sensitization to communities. And right now a policy is being put in place so that these persons can also be remunerated, because they have been volunteering for the longest time. And next, please. And I think that's the last slide. So I would say that we are benefiting a lot from such webinars. And I've also learned a few things from Rayam, Qatar, and we would like to also benchmark maybe if a platform is provided, so that we are also learning from other cities in the world. Thank you.
Thank you very much, Ms. Kimani from Nairobi. That was an incredibly rich presentation. Really impressive number of initiatives that are being implemented in Nairobi. I was struck by the focus on children and youth and vulnerable young people, and how you're trying to ensure their well-being from many different angles. So I think there was a lot in there that I'm sure cities around the world can learn from. And we, of course, will make all the presentations available online following the webinar, so that people can review the information in their own time. But thank you also, Ms. Kimani, for addressing some of the key points for today's webinar as well, on visibility, stakeholder engagement, and so on. So we'll have a bit of a discussion later, as I mentioned. I would like to also invite participants to post questions. So as you're listening to these very informative presentations from Al Rayyan, from Nairobi, and shortly Yeonsu, please do use the Q&A function at the bottom to pose a question. If you have simply a reflection or a comment, you're welcome to use the chat. So without further ado, then I'll move to the third and final presentation from the city level. And this one's coming from Yeonsu. This one has been pre-recorded as a video. So I will share the video with you now, and I hope you find it interesting.
안녕하십니까. 대한민국 연수구의 평생교육사 김용준입니다. 건강을 위한 평생학습 웨비나에서 발표를 하게 되어 대단히 기쁘게 생각합니다. 이번 웨비나에 초대해 주신 유네스코 평생학습원에 깊은 감사를 드립니다. 이번 발표를 통해 지난 2021년 학습도시 국제 컨퍼런스를 통해 만들어진 연수선언 이후 연수구의 건강을 위한 평생학습 정책 및 노력에 대해 소개하도록 하겠습니다. 본 발표에 앞서 연수구의 도시 현황 및 평생교육 영역에 대해 간단히 소개하도록 하겠습니다. 연수구는 대한민국 인천시 서남부에 위치한 도시입니다. 도시 면적은 56.2제곱킬로미터로 15개 행정동으로 이루어져 있으며 약 15만 세대, 38만 명이 거주하고 있습니다. 평균 연령은 40.3세로 다른 지역과 비교하여 인구 밀도가 높고 평균 연령이 낮은 젊은 도시입니다. 또한 2003년 교육부 평생학습 도시로 선정, 2018년에는 유네스코 글로벌 학습도시 네트워크에 가입하고 2021년 제5차 ICLC를 개최한 대한민국의 대표 평생학습 도시입니다. 지난 2021년 제5차 ICLC 연수선언 이후 연수구에 많은 변화가 있었습니다. 대표적으로 건강을 위한 평생학습 관련 기존 사업의 변화와 확대가 있습니다. 몇 가지 예를 든다면 첫 번째, 기존 구민만을 대상으로 했던 세계 시민 교육의 대상이 공직자까지 확대되었습니다. 두 번째, 관련 예산이 기존 예산 대비 약 10% 증가하였습니다. 세 번째로 건강을 위한 평생학습에 관한 시민의 의식 확대를 위해 새로운 캠페인을 내년부터 운영하게 되었습니다. 그 외에도 다양한 변화가 있지만 결론적으로 건강을 위한 평생학습을 위해서 시민교육의 필요성을 인정받아 평생학습 도시의 주요 사업으로서 전반적인 확장이 이루어졌다고 이야기할 수 있겠습니다. 그럼 좀 더 구체적으로 건강을 위한 평생학습 관련 연수구의 아웃리치 전략 사례를 공유 드리겠습니다. 바로 찾아가는 세계 시민 교육과 우리 동네 배달학습입니다. 도시에서 운영하는 대부분의 평생학습 사업은 주기적으로 학습이 이루어지는 공간이 있고 학습자가 그 공간으로 찾아오는 시스템입니다. 위 두 사업은 정해진 공간 없이 학습을 원하는 학습 모임 또는 단체가 있다면 강사를 파견하여 학습을 지원하는 사업입니다. 찾아가는 세계시민교육은 지속 가능 발전 목표 달성을 위한 세 가지 교육과정이, 우리 동네 배달학습은 학습자가 직접 교육과정을 구성해서 제안하는 방식으로 이루어집니다. 하지만 이 사업에는 큰 장애물이 있습니다. 바로 학습자가 학습의 의지를 가지고 있지 않으면 사업이 이루어질 수 없다는 것입니다. 두 사업은 시간과 공간의 문제로 학습에 참여하지 못하는 기존 학습자들의 편의성은 향상시켰을지 몰라도 학습에서 소외되어 있고 학습 의지를 가지고 있지 않은 시민들에게 실질적으로 다가가지는 못했습니다. 이것이 2023년부터 연수구에서 세계 시민학습 캠페인을 운영하고자 하는 이유입니다. 학습의 의지가 없는 일반 시민들에게 학습의 의지를 불어넣고 실제적 학습으로 연결되게 하는 것, 이것이 잘 이루어질 수 있을지 내년이 기대가 됩니다. 방금 소개드린 사업 내용은 연수구의 평생교육 전담 조직에서 운영하는 내용이었습니다. 관련하여 연수구 행정조직 내 평생교육 비전담 조직에서 운영하는 프로그램을 별도로 조사해 보았습니다. 조사 결과 영유아 및 부모를 위한 보건교육, 시민 건강을 위한 생활체육 및 식생활교육, 장애인 자립을 위한 재활교육, 청소년을 위한 진로교육 등 건강을 위한 평생학습의 범위 안에 들어갈 수 있는 다양한 사업들이 있었습니다. 평생교육 전담 조직에서 운영하는 프로그램이 전체 성인을 대상으로 한 총체적 시민교육으로 구성되어 있었다면 평생교육 비전담 조직에서 운영하는 프로그램은 조직 특성에 따른 대상 맞춤형 시민교육으로 구성되어 있었습니다. 결론적으로 건강을 위한 평생학습 관련 정책 및 프로그램의 규모는 비전담 조직에서 더 크고 활발하게 이루어지고 있었습니다. 이는 건강을 위한 평생학습 정책 및 프로그램은 평생교육 전담 조직에서만 수행하는 것이 아닌 조직의 모든 부서가 함께 수행해야 하는 것임을 의미합니다. 그럼 건강을 위한 평생학습 활성화를 위해 도시는 어떠한 노력을 할 수 있을까요? 위 그림은 지자체의 일반적인 평생교육 사업 추진 순서입니다. 중앙행정기관을 통한 법의 제정, 상위법을 기반으로 도시별 조례 제정, 조례를 기반으로 행정기구의 사업계획 수립, 그리고 실행의 4단계를 통해 도시에서 평생학습 사업이 추진되고 있습니다. 도시 수준에서 실현 가능한 노력은 2단계 및 3단계의 수준일 것입니다. 그러나 앞서 이야기했듯이 평생교육 비전담 부서에서 더 많은 사업을 추진하고 있는 상황에서 행정적으로만 접근하는 것은 건강을 위한 평생학습 활성화에 한계가 있을 것입니다. 이에 연수구는 2021년 이후 지금까지의 경험을 기반으로 건강을 위한 평생학습 정책 및 프로그램 활성화를 위한 3가지 필요성을 제시합니다. 첫 번째, 단체장의 의지입니다. 건강을 위한 평생학습 정책 및 프로그램의 확대는 조례의 제정, 예산의 확대 등 행정적 지원이 필수적입니다. 이를 안정적으로 지원하기 위해서는 단체장의 의지가 반드시 필요합니다. 두 번째, 조직 구성원의 이해입니다. 건강을 위한 평생학습 정책 및 프로그램은 기존에 없던 새로운 사업이 아닙니다. 이미 많은 도시의 조직 구성원들이 운영하고 있던 사업이며 이를 수행하는 구성원들이 인지를 하지 못했을 뿐입니다. 건강을 위한 평생학습의 확산은 조직의 구성원이 건강을 위한 평생학습의 의미를 이해하고 자신이 담당하고 있는 사업의 의미를 다시 한번 생각하는 것부터 시작될 수 있습니다. 세 번째, 시민의 인식 변화입니다. 아쉽게도 아직까지 시민들이 가장 원하는 교육과정은 문화 여가 및 인문 교양 강좌입니다. 건강한 시민, 건강한 도시는 다양한 시민교육을 통해 이루어질 수 있음을 시민들이 인식하고 도시에서 운영하는 시민교육을 참여하는 것에서 시작하여 먼저 도시의 시민교육을 요구할 수 있도록 해야 합니다. 이는 단기간에 이루어지기 어려운 일입니다. 도시의 대표는 물론 조직의 구성원과 시민, 양쪽 모두의 변화가 필요한 일입니다. 이를 위해 지난 제5차 학습도시 국제 컨퍼런스에서 연수선언이 만들어졌다고 생각합니다. 오랜 시간과 노력이 필요하겠지만 모든 학습 도시들이 연수선언의 내용을 기억하고 실행한다면 우리 모두가 계속해서 이야기하고 있는 건강을 위한 평생학습이 도시에 뿌리 내릴 수 있을 것입니다. 지금까지 경청해 주셔서 감사합니다. 제5차 학습도시 국제 컨퍼런스 이후 아직 많은 시간이 지나지 않아 유의미한 통계 및 결과를 함께 공유드리지 못해 아쉽습니다. 내부적인 상황으로 실시간 질의응답을 받지 못함을 양해 부탁드립니다. 오늘 발표 내용과 관련하여 질의가 있으실 경우는 화면에 나와 있는 메일 주소로 내용을 보내주시면 성실껏 답변 드릴 수 있도록 하겠습니다. 연수구는 연수선언에서 이야기한 바와 같이 건강한 시민, 건강한 도시를 위한 평생학습을 위해 앞으로도 최선을 다하겠습니다. 감사합니다.
Thank you very much, Mr. Yoongjun Kim from the city of Yeonsu in the Republic of Korea. Thank you for taking the time to pre-record your presentation to ensure that there was time to add subtitles in English and make all of these highly relevant initiatives accessible to a global audience. So very inspiring insights from Yeonsu, the city where indeed the Yeonsu Declaration was adopted in October 2021, just over a year ago, and which initiated this whole webinar series, this collaboration with the UNESCO chair to develop a guide on the promotion of lifelong learning for health in cities. So I think it's very appropriate that we end the city presentations with Yeonsu. And now to start to maybe reflect and unpack some of the many elements of these presentations, I would like to hand over to the UNESCO Chair for Global Health and Education, Mr. Didier Jourdan, who has been responsible for developing this enactment guide and really is the brains behind the webinar series. So over to you, Didier, for your reflections, please. Thank you.
Thank you very much, Alex. Thank you very much for all this great presentation. And you know, it's difficult to add something to all these presentations that are extremely concrete, operational, deeply rooted in the culture of the cities. But what is common? What is common is that clearly now lifelong learning for health is not an option. Lifelong learning for health is a condition to build healthy and resilient cities in preparation for the future crisis. And the commitment of the be prepared, not only individual, but also communities to be able to face with the different challenges linked to the crisis. So very few things to share after this 3 great presentations. And I would like to tell you that I'm going to take examples from these 3 presentations, then from Al Rayyan, Nairobi, Yeonsu, but also from the presentations of the cities who shared their experience during the 2nd webinar. I'm in Chengdu, Bogota, Cork, and also the city of Clermont-Ferrand, with which we have a very deep partnership, a very close partnership. So if we try to reflect on the question of the sustainability and the visibility of our lifelong learning for health policy, by definition, we have to have in mind that it's based, on 3 key components. There's no sustainability nor visibility without strong, clear, and appropriate policies, without structures and systems, a kind of institutionalization, without practices, and without human resources. These determinants are the key factors of sustainability and visibility of the lifelong learning for health policies. Remember what our colleague from Yeonsu just said: without the commitment of the citizens, without the awareness within the population of the challenge linked to health learning, then it's extremely difficult to move forward and to prepare the population for the future crisis and to build healthy and resilient cities. So concerning the first field, which is policy, we learned a lot from the different cities. I just would like to underline a few points. In every case, the activity linked to lifelong learning for health policy is based on an intersectoral partnership between the education, between the health sector, and also all the different actors linked to sport, tourism, culture, a reduction of the inequalities, social policy. So clearly, the key aspect is the local policy that is connected to the different dimensions, and that led to a plan which is structured and organized at the city level. And we just had a lot of examples that are very comprehensive. These policies are linked to all the different dimensions of the life of the people. In other words, what we are talking about is the determinants of the health of the people, the determinants of their capacity to take care of their health individually and collectively. What we just learned from Nairobi, Yeonsu, and Al Rayyan is that it's possible through the different local policies to influence these different determinants via education processes. The second determinant is the structures and systems. These structures could be physical organization, like greenways, like facilities for physical activity. Think of the fitness box of Al Rayyan. It could be also a kind of pathway. We talked a lot about the health learning pathway, and we have the example of the health learning pathway now in Clermont-Ferrand, where all the different contributions of the stakeholders at the city level, formal, non-formal, informal institutions, to the learning of the population. The question of the school is also extremely important. Not all cities underline that, but some of them show how there's a clear interaction. I think of what our colleague from Nairobi talked about, the dissemination of the school health policy to the different schools at local level, and to strengthen, for example, the school health clubs. Concerning the practices, there's an incredible richness of practices that are linked to the mobilization of advertising platform, the use of the communication tools of the municipalities, the use of the different programs linked to hearts, linked to health education, linked to the role of the different dimensions of the environment on the health of the people. These practices are the practices of all the people in charge of education and all the people who are having an impact on the lifelong learning process of the people. The last one is about the human resources, where you can see, for example, in some cities of the different actors, you can identify all of them. Think of the way in which Yeonsu tried to federate all the different actors to help them to build a real awareness of their contribution to the lifelong learning for health policy. This is also extremely important to talk about the capacity building of the different stakeholders, wherever they are, not only directly connected to education of health, but those who have a real impact. Taking care of the existing human resources, as our colleague from Al Hayyan talked about earlier today, and also developing the capacity in order to have the human resources we need. So just to summarize what we can learn from the three and probably more with the other contributions is that lifelong learning for health policy is always based on two pillars. The first one is the strategies to develop people's health skills. This is the learning angle. But in all the cities, it's also about the educational environment that makes possible the health learning. It's not only the content. For example, when you talk about the bursaries in Nairobi, when you talk about the way in which you reach the most vulnerable people, it's also about the creation of the condition of an efficient learning process. So what we can learn from these different cities is that there's two pillars: the learning process itself and the condition to make this learning process efficient. So in general, if we try to summarize what we learn about the experience of all these cities, is that this health learning pathway could be one of the expression of the lifelong learning for health policy at the city level, involving the different actors at the different age of the life with these two dimensions, the learning process and the condition for an effective learning process. What are the challenges? What do we learn about the challenges? Of course, the intersectoral work, which is not evident at all because most of the institutions are working in silo. So this is something which is critical in this process. I mean, may be giving the possibility for education and health sectors to work together. The second challenge is the inventory. You know, any cities in any condition, they do not start from scratch. What is just incredible in the example we had today is that the process that led to the creation of the lifelong learning for health policy is always based on the existing assets of the cities. So yes, it's always beginning by this inventory and then to structure these different contributions through a pathway all along the life, and then through this lifelong learning for health process. There's also the challenges of keeping the commitment alive and the visibility and the sustainability. But probably what is common to all these different examples is the need for the capacity building of the people, of the institution, how to develop not only the awareness, but also the capacity for all the different people involved in the lifelong learning for health policy to play an efficient, effective, relevant role in the development of the population's capacity in relationship to health. Over to you, Alex.
Thank you, Didier. Thank you very much indeed for a very smooth, very neat summary. And with this being the third and final webinar in the series, I think it was very helpful to gain those insights into really interventions across the series. and for you to extrapolate some generalizations, some conclusions based on all the interventions from cities, the engagement that we've enjoyed from members of the GNLC and beyond. So hopefully that for the participants just summarized all of the points that we've been seeking to clarify through this series. And in most cases, really shining a light on what is already happening. So not starting from scratch, not imagining that we're in a position at the beginning where lifelong learning for health is non-existent. That simply isn't the case. There is already so much happening within cities to support learning for health. And this has been more about how to build a cohesive policy that looks across all spaces in the city, involves all actors, reaches all vulnerable groups, so that there is a consistent pathway available to every local person. So with that, then we'll move to a question and answer session. And once again, I would like to remind participants that you can ask questions via the Q&A function. So please do so. And if you have some comments, reflections, you can post those in the chat. We have, I think, 1 or 2 questions coming in, but I'd just like to start with one for all cities and for Didier as well on the actual process of implementation, because I think that we shouldn't necessarily think of implementation as coming at the end of a very linear process, where you begin by devising a concept, designing a policy, which is ultimately then implemented, and that's the end of the process, but rather there's a constant cycle where policies are being informed by what's already happening on the ground. They are then being supported by policies that are created. So I would like to ask the cities that participated, as well as Didier, how you see this process, this kind of organic policy making and policy implementation process. So to what extent is it happening from above and being implemented? And to what extent is the work that the city is doing influencing policy development? So maybe just thinking about engagement between different levels, so national governments. We saw in the case of Yeonsu how there's a lifelong learning or a lifelong education act at the national level, which supports lifelong learning at the local level. So within your cities, how are you engaging with national authorities, county governments, city governments, sub-counties were mentioned by Nairobi, community groups? So that engagement really up and down the various different levels, how does that influence the implementation of learning for health in your cities? So once again, then we can reintroduce Ms. Almari from Al Rayyan, Ms. Kimani from Nairobi. Are you still with us?
I am myself.
Thank you, Ms. Kimani. So could you speak maybe just briefly about how you work with those different levels, moving up beyond the county and then down to the sub-counties, the community groups? How do you establish a dialogue across those various levels for lifelong learning for health?
Okay, thank you. Like you have rightly said, we are in a devolved government structure whereby we have a national government and 47 county governments. Nairobi City County government is one of the devolved county governments. And incidentally, health is a devolved function. So we collaborate at the county level because we work under the same institution, under the same governance structure. So it is very easy, and that is why we even have a school health department. So it is a department within the health department, but it entirely offers services to our schools. So our collaboration is we actually collaborate very easily because it is within the same level of the government, now that health is a devolved function. And we do not find it very difficult to work together. However, we also have some health facilities that are run by the national government, especially the referral, the national hospitals and referral hospitals. And should we have any programs to undertake that will require our collaboration with them, then we always write to the health ministry through the Ministry of Education. And I believe there is a clear structure on how communication is channeled. I don't know whether I'm answering your question sufficiently.
Yes, very much so. Very much
Okay.
so. Thank you. Thank you for that. And I wonder, Didier, whether you have any reflections in your experience working with lots of cities around the world, this kind of negotiation between the various levels.
Thank you very much for this absolutely crucial question. For one reason is that the political organization and the mandate of the city, the council, the municipalities in terms of health differs a lot from a country to another, a context to another. So one size does not fit all. Clearly, it's linked to the context, the national context, but also the local context. What we learn from our experience all over the world is that it's always an iterative process. It means there's always loop. You cannot have the kind of national policy that is clear and totally finalized and then the implementation at the local level. It's never like that. It's always local initiatives that generate changes in the laws, in the organization of the structure. And then I mean that we have to free the initiatives of the cities because they are key actors to contribute to the change at the national level in terms of lifelong learning for health. Always this loop, this iterative process. The second thing I would like to underline here is the link with the question of the sustainable development. This dialogue between the national, the regional, the local level has to be under the umbrella of the resilience of our communities, of our cities, of our countries, through the lens of the sustainable development. Health, is not separated from the other key challenges of the sustainable development. Think of the climate, think of the environmental issues. So this dialogue has to be under the umbrella of the sustainable development, the creation of the future of our societies, and it's linked to all the dimensions of the lifelong learning for health. Over to you, Alex.
Thank you for that, Didier. Thank you. And indeed, it is an iterative process, and we see that across all the various themes that we work on through the UNESCO Global Network of Learning Cities, whether it's health and well-being, education for sustainable development, whatever it might be, with global citizenship, education. It's always iterative, and more often than not, there are local initiatives informing national policies rather than vice versa. But of course, there's a role for both to play. So we had a reflection, not so much a question, but a reflection shared in the Q&A. So I'd just like to read this to you and then invite reactions. Unfortunately, we no longer have Al Ryan with us, and Yeonsu cannot participate live in the question and answer session due to a lack of Korean interpretation. So not to put you on the spot, Ms. Kimani and Didier, but we would very much appreciate your reactions to this reflection. So this came from Abril Salada, and in fact now has been followed by a question. Okay, so the reflection. Thank you very much to all speakers for these excellent presentations. I agree with Didier Jourdan, since nowadays lifelong learning as an objective for sustainable development is not an optional decision, but rather an obligation that each citizen has within our societies and even with ourselves. As citizens, I think it is important to constantly promote learning for health policies, and especially to highlight the importance of mental health, because today society still sees mental health and mental health care as an exception only for some people, potentially as something strange. But the reality is that to promote a resilient society, we must understand the importance of taking care of our mind and not see mental health care as something unusual or extreme. So this was followed by a question. What policies would you implement to promote the normalization of mental health care? And it's an interesting one. I would like to thank Abril Salada for that question, because I think all of the fascinating initiatives that have been shared today, generally, they have focused on physical health. And of course, this is of paramount importance, but maybe then we just move in the discussion to mental health. So I wonder, Ms. Kimani, are there initiatives that come to mind in the city of Nairobi, where there is perhaps a focus on mental health or indeed well-being? So I know you mentioned the one for the people living with HIV and AIDS. There are initiatives to really raise their self-esteem, improve their integration in the local community, to prevent isolation. So of course that will benefit their well-being. But I wonder if there are other examples you'd like to share with us, please. Thank you.
Thank you very much. I agree that is a very critical component, mental health, that has been sidelined for quite some time. Yes, we have programs towards mental health wellness. And recently, our governor, who assumed office in early September, has given a directive that we incorporate psychosocial support programs in all our educational programs. So we are in the process of ensuring that we have counseling units for teachers and students. And also within the Human Resources Development Department, we have a counseling unit where we refer our teachers who may be faced with issues or who we suspect to have issues, mental health issues. And recently in Kenya, we've had a trend of students either committing suicide or even killing family members. And that is associated with mental health and wellness, if so to speak. And so the psychosocial programs that our governor has directed that we encompass in our schools will go a long way. So we are in the process of coming up with those, but meanwhile, we only offer counseling services and also refer those teachers who we suspect to have mental issues to the counseling unit that exists in our Human Resources Development Department. Thank you.
Thank you very much, Ms. Kimani, for those insights. And Didier, I see that you...
Yes, yes. Thank you very much, Abril, for this question. This is absolutely crucial. I just would like to focus a minute on children and adolescents. The impact of the COVID-19 crisis on the mental health and the well-being of the children and adolescents was huge. We consider now at a global level that between 16 and 20% of the children and adolescents have mental health difficulties, and they are suffering in their well-being. So, of course, it's at the very core of all our policies. I just would like to take one simple example. This is the city of Clermont-Ferrand. This is the process of the building of the health learning pathway, and it is focused on mental health and well-being. When it's about infancy, early childhood, this is creating the conditions for a positive parenting. During primary school, this is the interaction between the school where you develop life skills and also emotional competencies, and the sports club, which are involved at the local level. When you are at the middle school and high school level, this is programs about the stereotypes, this is about harassment, and this is also the clear connection with the local policy in mental health sector, education sector together. There's also one dimension in the question of Abril. It's the fact that an important part of the population have a chronic condition linked to mental health. And this is a key question of inclusiveness. And I think, yes, he is right. Lifelong learning for health, it's for all people, including the people suffering mental health issues from a chronic perspective. Over to you.
Thank you, Didier. Thank you very much. And for highlighting as well that perhaps mental health issues have become, or have increased in number and perhaps become more prominent during the COVID-19 pandemic, particularly among younger people. So I think we have time maybe just for two more questions. I don't see any in the Q&A, but there is still time. If any of the participants do have a question they would like to be addressed by the panelists, then please do share it with us. We have just a few minutes left, and I would like to ask quite a general question, and this probably touches on presentations we've seen over the course of the webinar series between June and today. The idea of lifelong learning for health. When you are designing initiatives and policies and implementing such a wide range of initiatives to support lifelong learning for health, how do you strike a balance, or indeed should a balance be struck, between the idea of proactivity, so health promotion, disease prevention, looking ahead to be proactive in order to stop problems developing, and then on the other hand reacting? Because I think over the past couple of years we've seen a big emphasis on reactivity, particularly in the middle of the COVID-19 pandemic. It was, how can we react quickly to this disease, this virus that is spreading rapidly? How can we solve a sudden issue? But of course, there has to be a focus in the long term on proactivity and prevention. So just considering those two, and of course they overlap. Ms. Kimani, in Nairobi, I mean, all the initiatives you shared, I think, point to both. But how do you see that from your perspective, the idea of preventing potential issues further down the line and promoting good health, and balancing that with the need to react to major issues that are already present within the city?
With the issues of promotion, I think the increase of mental health issues is emanating from hardships or a quality of life that has been that has deteriorated, and especially with the effects of the COVID-19. So preventive measures that we are putting in place are those that are towards socioeconomic empowerment, such that communities, whether in groups, youth groups, elderly people, because we actually also have homes for the elderly, the vulnerable groups, including the street children. We ensure that we have programs towards economically uplifting their lives, so that they do not result to depression and other related illnesses. So those are some of the preventative, and we are also raising awareness and also ensuring that people get to know that mental illness is actually a disease like any other, because previously it has been looked at as like in the African context, mental illness was previously associated with witchcraft and retrogressive cultural practices. So we are raising awareness that this is a disease like any other, and it needs to be addressed as such, using preventative measures like those that improve the quality of life. When we come to the addressing the issues, we are addressing through psychosocial systems that include counseling, and also ensuring that the family unit is incorporated, so that the people who are affected, and especially our teachers, and if there is a problem that is emanating from home and it is translating to the work environment, we ensure that we address it wholesomely without addressing it from just the workplace point of view, but we ensure that there is at least tracing back to the family, and ensuring that there is support that is also offered from the family level. Yeah, I think that is what I would say for now, not unless there's any other part that you would want me to emphasize. Thank you.
Thank you very much, Mr. Kimani. That was really very insightful response to the question, and touching on how health also relates to social inclusion, economic empowerment, the role of cultural practices, and this truly holistic perspective to learning for health. But over to Didier.
Thank you very much for this question. You cannot separate these two dimensions, and I would like to be very concrete, talking about the initiative of the city of Lausanne in Switzerland with old people. Again, lifelong learning for health, it's lifelong. And all the studies show that increasing health literacy of old people have a direct impact on their health. Then the work has been done during the pandemic about how to react, how to protect ourselves, and how also to understand the different message. It's a question of media literacy, so it's how to react. But at the same time, this lifelong learning process, which is go through home and health care, is also linked to the different determinants of health, linked to the environment, to nutrition, to the prevention of falls and all that thing. So this is clearly the two sides of the same coin, and that's why we are always talking in terms of pathway. Why a pathway? Because this is a lifelong process, and the different contributions that contribute to create the conditions for how life, all over the life, and this is of course a decadational contribution. This is contributions from the healthcare, from the social system too. So yes, the two sides of the same coins. Alex, over to you.
Thank you very much. Thank you, Didier. So we are running out of time for further questions, unfortunately. I did see there was another one in the chat. I'll just read it briefly to see if we could have a quick reaction. It's from Zingizi Gukwede from Namibia. So he's asking whether you would make a distinction between a lifelong learning policy that encourages citizens to continue their education throughout their lives and a lifelong learning policy that focuses on improving health. So would you see that there is a distinction? And then he summarizes, can policies for lifelong learning handle both lifelong learning and learning for health at the same time? So I would say yes, but Didier, I don't know if you have a quick response to that one.
Oh yes, clearly, yes. And yes, lifelong learning for health is part of the lifelong learning process. Why? Because, you know, citizenship includes a lot of dimensions linked to, of course, the environment, linked to the social participation, and linked to health. And then, yes, this is the development of the capacities of the citizens through lifelong learning, and in one of the critical field of nowadays citizenship, which is health. So yes, and health, yes.
Perfect. Thank you very much, Didier. So let's finish on that positive note. I would just like to thank our presenters once again. So Ms. Almari from Al Rayyan, Mr. Yoongjun Kim from Yeonsu, and particularly Ms. Esther Kimani from Nairobi for also staying with us and making such fascinating contributions to the question and answer session. So thank you once again, Ms. Kimani. And with that, then, I would just like to mention that as we draw to a close of this webinar, but indeed the three-part webinar series, I'd like to draw your attention once again to the enactment guide. So we have been developing with Didier an enactment guide for cities to promote lifelong learning for health, to build a health learning pathway. It's full of very, very rich resources, tools, practical guidance, and we're in the process of finalizing the guide. So over the next few weeks, we'll finish receiving feedback from cities, from you, from participants in the webinar series. We'll also work on integrating a few case studies received from cities around the world to finalize the guide, and then publish it probably early next year so that you can then have it as a tool, hopefully physically as well, to guide you in all your efforts at the local level on learning for health. So my colleague is posting now, I believe, in the chat. So my colleague Paolo has just posted a direct link to the guide. So please click on that and you can read through the guide at your leisure. But there will also be a link to a survey. So we actually created a survey to attract feedback from city stakeholders on the content of the guide. So please do take some time just to read through, think very critically about which bits you find particularly useful, maybe also parts that don't really apply to your context. And then please share with us your honest feedback through this survey. And my colleague Maria has just posted a link to the survey. So yes, that would be our kind invitation to you to ensure that you can co-create this guide with us, read through it, and then please visit the survey and just take a few moments to complete that survey and to send us your responses. We'll also send the link again, I think via email, just to make sure that everybody has it, so that we can, in the next few days and over the next couple of weeks, finish the process of gathering feedback from cities. So with that, on the dot, I would like to thank everybody for being here today. I would like to once again thank the presenters. It's been a fascinating webinar series, and with the launch of the guide, we'll continue our work on this very important topic of lifelong learning for health. So thank you to everybody, and I wish you a good day, evening, wherever you are. Goodbye.